Right now, we are seeing relief today from the heat, but don't be fooled. Our Weather Impact team is tracking some extreme heat as we head towards the weekend, including our first 100-degree day of the year, and it's only June. As we prepare for the heat, we are talking about hydration and other things that you need to know. So we're bringing in our 9 News medical expert, Dr. Payal Kohli, about how we can keep ourselves safe during heat. I mean, it's really dangerous. People die in the heat. Every single summer we hear about this.
And things are getting hotter, and so we're getting exposed to more heat than ever. And so we actually have to change our behaviors when it's hot out in order to adapt, because our bodies are not designed to be in this type of heat. So the first most important is what you said, Kim: hydrate, 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 even when you're not thirsty. And that's the key here.
So when you're thirsty, you're already dehydrated?
You're behind. Not only that,
that happens to me quite a bit.
As we get older, our ability to become thirsty, our thirst receptors don't work as well. So we don't even know when we're behind. Same if we're pregnant. And sometimes when it's really hot as well, we can't tell that we're thirsty because we're having signs of heat exhaustion, which can impair our ability to know that we're thirsty. So you just need to fill up the bottled water and just keep drinking all day long. You also need to change how you eat. So oftentimes we just keep eating the same things we would normally eat, whether it's cold or hot outside. You really want to eat much lighter, easier to digest food. So you're not eating a big cheeseburger for lunch. You're eating something like a gazpacho, a cold soup, something that has liquid in it, but flavorful, with lots and lots of electrolytes. Or if you prefer to drink, then you can have a nice homemade lemonade that doesn't have a lot of sugar in it, but has some electrolytes in it as well.
Those are good, healthy tips. Now, what about red flags if you're dehydrated? I know, like with my dog, like you can pull up their neck and see the elasticity. Anything that we can do to find out if we are close to dehydration?
Yeah, so the first clue is to look at your urine every time you go to the bathroom, and try to get in the habit of doing this every day anyway. So you can look for blood, you can look for, protein, anything else in it. But if it's really dark yellow or amber, you're way behind. So it should be colorless or pale yellow in order to know that you're sort of keeping up. Skin turgor, as you said, is the other one. So if you pinch your skin either on your forehead or on your hand and it tense for a second, that means you're getting behind, you're getting dehydrated. And then mucous membranes, your lips, your mouth, anything that feels dry, even your skin, these are all signs that you're getting behind as well, like your eyes.
Okay, so these are things that we all need to, how do we know when the heat is like getting to us? I mean, sometimes I feel like I get just sleepy.
Yes, me too.
Yes, so that's one of the earliest, most subtle signs. So that's actually a sign of heat exhaustion, which we've all had, where you just feel a little more tired, right? You just want to go sit on the sofa. Maybe you're feeling a little nauseous or not too hungry. You're a little bit fatigued. You might be sweating a little bit. Your heart rate is a little faster. Those are things you might not feel, your heart rate being faster, your respiratory rate being different. Your body is trying to blow off heat by having you breathe a little faster. So all of your systems are sort of amped up, which is why you're feeling more tired, because your body's overcompensating to try to control your body temperature. So if you are starting to feel tired, then that's a sign you might be starting to have heat exhaustion, which can quickly progress to heat stroke, which is life-threatening. So if you have heat stroke, you can actually go into coma, die from it. And certainly older people, people on chronic medications, pregnant women, infants and babies, and pets, these are all.
Yeah, we always worry about a baby, cover their head in the winter months. You forget they can't be out in the heat too.
It's so true. And we talked about the heat. You have less than 30 seconds, but it's raining outside. Anything with cooler weather or rain that we should be aware of that also could be dangerous?
Yeah, so for a lot of people who have asthma and allergies, it can aerosolize mold and mildew. So you can actually get rain-related asthma or wheezing episodes. It does clear the dust out of the air, cools down the temperature, which is nice, but just keep an eye on that if you're somebody who suffers from chronic asthma or chronic allergies. But as it gets hot, ladies, we have to make sure we prepare our bodies, not spend too much time outdoors, and we're doing all the smart things.
We just needed 70 degrees every day. Perfect, but whatever. Kathy can't always deliver.
No, she can't. No.
You can find more from Dr. Kohli at 9news.com/Dr. Kohli.